Hello and welcome to Health Matters on Channels Television. We are delighted you could join us. I am Mary Alale Yusuf. Fetal alcohol syndrome is a condition that can occur in a baby whose mother drank too much alcohol during pregnancy. Troubling conditions may include poor coordination and behavior problems. Global prevalence figures are not reliable because of ignorance and the stigma attached to it. But a 2005 study put the approximate global incidence at 0.97 per 1,000 live births. That's purely speculative because of the way it's reported. The research for this study was done in the United States. Fetal alcohol syndrome is gradually being recognized as a public health problem, and some governments embark on targeted prevention programs, but in many countries, most of the work is left for voluntary agencies. My guest on this episode of Health Matters is Dr. Ayodele Renner, a senior registrar in pediatrics at the Lagos University Teaching Hospital, Idi-Araba. You're welcome to the show, sir.
A very good day to you, Mary, and thank you for having me on the show.
What does fetal alcohol syndrome look like? Does it have characteristic features?
Thank you very much for the question. So, as a matter of fact, the way in which fetal alcohol syndrome is diagnosed is primarily through the characteristic features, and these features are features especially located on the face. Now, such features could include a small head. They could also have what you call microophthalmia, which means that the eyes are
tiny
small.
Eyes.
Yes. They could also have what you call a mid-face hypoplasia, meaning that the mid-region of their face, their nose, and the upper, their nose area is rather small. Then there's this part of the face between the nose and the upper lip that is called the philtrum. It's a groove, and that groove is absent in children with fetal alcohol syndrome.
But everybody else has that groove?
But everybody else has that groove. It's that fine groove here. And then their upper lip is very thin. And so those are the facial features that help us to identify children who have fetal alcohol syndrome.
So does that now mean that every child with those features has fetal alcohol syndrome?
Well, it doesn't mean that necessarily. What needs to be in place for you to make the diagnosis of fetal alcohol syndrome is that there should be a history. You should have obtained a history of the fact that the mother consumed alcohol during pregnancy. However, sometimes you don't always get the history of the mother having consumed alcohol during pregnancy because, for obvious reasons, it does look, it can be stigmatizing.
Irresponsible.
Yes, if a mother says, I drank alcohol in pregnancy, so not all mothers will tell you that. So when we see those characteristic features, we are actually allowed to presume that the child has fetal alcohol syndrome. Apart from those characteristic facial features, they also develop things like central nervous system problems, such as behavioral abnormalities, hyperactivity, and cognitive impairment, such that they don't actually perform as well as their normal counterparts.
So they don't get to understand things in school the way other children do.
Amongst other things, including their motor skills, including coordination, including sensory perceptions, those things are actually affected.
Could it be mistaken for Down syndrome?
Down syndrome actually has very characteristic features, such as upward slanting palpebral features. The palpebral features are basically the eyes. And with Down syndrome, they go upwards. And Down syndrome patients also have a flattened nasal bridge. They have an apparently...
But that's the same thing as the fetal alcohol syndrome.
They look very similar. And Down syndrome patients also have what you call hypotonia, such that when you lift them, they feel rather soft and a little bit lax. That is not a prominent feature of fetal alcohol syndrome.
Okay, this is what I saw as the presentation of a child with fetal alcohol syndrome, if you look at the screen. But that child looks pretty fine to me. What's wrong with his ears?
Okay, so his ears are low set. So his ears appear low set, meaning that...
Yes.
Meaning that if you draw a line between the lateral canthi, which is the lateral aspect of the eyes, to the occiput, which is the prominent...
So a line across the eyes, right down to the head.
Right down to the occiput, exactly.
It's supposed to touch the top of the ear?
At least 1/3 of the ear is supposed to cross...
1/3?
Yes, it's supposed to cross that line.
That means that ear was really, really low?
Really low. That means the ear is low. So anybody's ears who fall below that line, then the ears are said to be low set. And as I said, it does overlap with a few other abnormalities.
Would you say that that child has a look like he's not in possession of his full wits? doesn't really look smart?
Truth be told, fetal alcohol syndrome, now it's actually termed fetal alcohol spectrum disorders, of which fetal alcohol syndrome is the most severe form. You also have the partial fetal alcohol syndrome, which is not as severe as the actual fetal alcohol syndrome. Then you also have alcohol-related neurodevelopmental disorders.
Oh, so it's a whole spectrum of trouble. Do they all occur together? Are they comorbid?
Unfortunately, the condition has not been studied that extensively.
For obvious reasons?
Yes, for obvious reasons, because not so many people would, first of all, recognize it. Not so many people would present unless the child presents with something life-threatening, like cardiac defects, which they can present with. So presentation doesn't come, they don't present very readily, and there is no obvious criteria for going actively to identify these children, so they can be missed.
What would you say has been the earliest presentation of such a child? When do they usually notice something is wrong?
Okay, now this is a very important question, because as you said, you pointed at that child and you said the child looks normal, the child probably even looks fine, and people might actually say, oh, such a small mouth, how cute. But at the end of the day, it takes a specialist to actually know that these eyes are rather small, these palpebral features are small, this head looks rather small, this philtrum is absent, upper lip is thin, and there aren't that many specialists. As a matter of fact, most of the deliveries in Nigeria take place in peripheral centers where people are not necessarily trained to look out for facial abnormalities.
Are those some of the things you look out for when you're scoring the child 7/7 or 20/20 when he's born?
As a matter of fact, it is actually necessary when we take deliveries in any center, but more so in a tertiary center, that we try to identify abnormalities in the facial features of children. Those are one of the first means of identifying chromosomal abnormalities in children.
Okay, I got ahead of myself. We were going to find out how soon do people usually bring such a child as, with a complaint that something seems to be wrong with this child.
Now, it could actually vary depending on the severity of the condition. So nobody is sure as to what amount of alcohol. I'm sure you're probably going to get to that as well. But the severity varies. So for children who have cardiac defects, which, as I said, can be one of the presentations of fetal alcohol syndrome, cardiac defects can be very dangerous and can actually present very early in the newborn period, depending on how severe the structural defect. So what we would normally call a hole in the heart.
Okay.
So if this hole in the heart that is caused by the fetal alcohol syndrome is very large, can actually present very early. And so they'll bring the child with things like respiratory distress. Okay. Sometimes, if the mother has consumed alcohol very close to pregnancy or very close to delivery, the infant might have what you call alcohol withdrawal, such that when the alcohol is wearing off from the child's system, the child begins to have symptoms such as tremulousness and sometimes even convulsions and seizures. So it really does depend on what the context of the presentation is.
Is there any time in pregnancy that is actually safe to take alcohol?
Very good question. Unfortunately, there really isn't any time that is safe. While people say that the first 3 months is very critical for development of the fetus, then again, even later in pregnancy, it has been found that consuming large amounts of alcohol, especially binge drinking, can still result in certain neurodevelopmental problems for children, for the fetuses. So studies have showed that even low to moderate, they're not too sure of what the effects of low to moderate alcohol consumption is. So to err on the side of caution, is advised that women abstain from alcohol altogether in pregnancy.
But some women drink. They say it makes them feel better. What are they feeling better from? What are they trying to subdue or address in their bodies?
So pregnancy is a very stressful time. It can be a joyful thing, but pregnancy can be very turbulent, can be very stressful. Sometimes nausea can be an issue, sometimes body pains, sometimes even the psychological effect of having to carry another life for a whole 9 months can be extremely stressful. And alcohol actually is a means of relieving stress. Alcohol is a drug. And so for some women, it's very calming, it's very relaxing. And sometimes in this social setting, it's part of social engagement and it's part of social life for you to, bottoms up and have a few drinks here.
Okay, so here's the critical question that is following that one. This woman is stressed, she's pregnant. and she doesn't want to drink because she knows the consequences. Is there help for her in the hospital to, should I call it, handle the crave?
Help to handle the crave. Now, cravings can be very difficult to handle. So the first thing is actually family support. So your personal support system is the first port of call for you for a pregnant woman. But it is
difficult to get personal support for a woman who drinks.
Who drinks, especially in pregnancy, because everybody is going to wag the finger of judgment at her and say, you're drinking alcohol in pregnancy. You should know better.
That's
and
right.
So she probably won't go to, certain people. But at the end of the day, if you do have people who are supportive, and that is what a pregnant woman should find, for instance, her spouse, a very close sibling, you let them know that this is what I'm going through, this is the problem I have. And if after all the attempts to help her to kill the craving, because usually you try to replace one craving with another. So if you're looking for alcohol, try and eat chocolate, try and exercise, try and swim. If that doesn't help, then yes, professional help needs to be sought. So the first port of call, of course, will be antenatal clinic, and they will interview her and ask her how much alcohol she's taking and when these cravings come. When these cravings are worse, is it when you're with your friends? Is it when you're in a social setting? You try to avoid those settings that increase your likelihood of drinking alcohol. And you should also, if all has failed, then professional help should be sought from the behavioral physicians, like the psychiatrists.
Okay, if a child is brought to you early, who has Fetal Alcohol Syndrome.
Okay.
Is it possible to mitigate some of these effects? Is it possible to reduce some of the effects of the Fetal Alcohol Syndrome?
Okay, I think I know that one. With fetal alcohol syndrome, unfortunately, we call it the effects in the central nervous system and the behavioral problems and the cardiac defects and the facial abnormalities. They are what you call a static insult, such that the insult occurs once. And unfortunately, when that occurs, it occurs in this phase when the brain is still undergoing development. It cannot be reversed. So when
not even by plastic surgery?
Not even by plastic surgery. So maybe the facial abnormalities, you might decide that, I'm sure in very advanced countries and centers, yes, plastic surgery can help with some of the facial abnormalities. But the central nervous system problems, unfortunately, cannot be reversed. They just have to be managed. So the cognitive impairment, you have to tailor their learning needs to their intellectual capacity. However, the cardiac defects can be amenable to surgery. Depending on the complexity of the defect.
Okay, let's take a short break. We're going on a break right now. We'll be back in no time. Stay with us.